All right, welcome to TIL Talks with Chris White, where we talk TILs, tumor infiltrating lymphocytes, and all advanced cell therapies, both with patients, caregivers, and industry leaders. Let's get going. In today's episode, I'm talking with Mrs. Katie Doble. Katie is a ocular melanoma patient survivor due to TIL therapy treatment in a clinical trial. We connected through a AMIT Melanoma Symposium in 2022. She was the first person for me to connect with in person outside of the internet that has done TIL. And I'm super excited to have her on today and to share her story and to talk TILs and all advanced cell therapies. Let's give a warm welcome to Mrs. Katie Doble. What's up, Katie? Welcome to TIL Talks. Thank you so much. I love that you're on here today. Today is Rare Disease Day, and there is no better time than to be doing what we're doing now. And I just got to thank you for coming on.
Yeah, happy Rare Disease Day, Chris.
Absolutely. So you are literally the first TIL therapy patient outside of myself that I met in person. I met other ones online, but I met you in person in September of 2022 at an AMIT Melanoma Symposium in Colorado. And I was like, wow, an ocular or uveal melanoma patient that received TIL. And I was just like, I got to get to know you. So give us the 101 about Katie Doble.
Yeah, I remember that day, and I remember that you were confused about how my hair was not white, and I had never
Yes.
heard of that side effect before, and so I will never forget that. I was diagnosed in 2013 with a rare form of melanoma called ocular melanoma. It impacts 6 in a million people. And when I was first diagnosed, I was 31 years old. It was contained in my left eyeball, and I underwent a week of plaque radiation therapy to my eye. I lost all vision in my left eye. And the biopsy results from that procedure showed that my tumor was classified as a 1A, which meant that there was a less than 2% chance that my cancer would spread. And so I thought I was done. I began getting back to life, readjusting to life without depth perception. I used to play Gaelic football, had to give that up because I can no longer catch a ball anymore, which you can't do without depth perception. And then the doctor recommended, even though I was a 1A, he said, I think we should just to be safe, let's do ultrasounds on your liver every 6 months, chest X-rays as well. And so I had my first liver ultrasound and chest x ray in April of 2014. And it was fine. I went back in 7 months later in November of 2014. It was 2 days before Thanksgiving. And I received a phone call from the oncologist that afternoon asking me to call her back right away, which is never the voicemail you want to get. And
Absolutely.
so I called her back, and she told me that they found 12 plus suspicious lesions on my liver, that it was likely that I had fallen into this 2% category, and that in order to be sure we knew what we were dealing with, I needed to have a liver biopsy on that week. And the next day, that liver biopsy got scheduled for Friday. Thursday morning was Thanksgiving. My dad flew in. My dad is a doctor. He's played a key role in my survival, and he flew in so that he could be with me the following day for the biopsy. That afternoon, in front of family and friends, my boyfriend of just over a year proposed. So it was a very emotional week, to say the least. And the biopsy the next day confirmed that it was melanoma. And I soon learned, my dad learned that I likely had 16 months to live. I was in the room when the doctor told me that, and I have no recollection, and neither did my fiance, my now husband, which I think goes to show just how much of an information overload you experience as a patient in the beginning. I'm glad that I didn't know that. I don't know that I could have handled that. And my doctor told me that I had one treatment option. She told me I would start on Yervoy, so I got signed up to start on Yervoy, which is FDA approved for cutaneous melanoma. It does no favors for ocular melanoma. And my dad asked her, "Well, what about clinical trials?" And she replied, "That would be very expensive." Thankfully, I had my dad. I think most patients would have just trusted their doctor. My dad then spent every waking moment on the phone with doctors all over the country. With rare diseases, you cannot, if you are not with a specialist, you are not in the right room. You cannot trust somebody who knows nothing about your disease. And what's unfortunate for rare diseases is that you are likely going to have to travel. I live in Denver. It's not like I live, in Podunk, USA. Like I live in a big city with a great research hospital, and there was not a specialist in the state of Colorado who could guide me. So my dad got us an appointment at Memorial Sloan Kettering in New York City. I did go to my training for Yervoy. I went to the orientation at the local hospital. Was supposed to be starting that in like a week. And I think the Friday before, my dad got me this appointment at Sloan Kettering, and I called and canceled the Yervoy and went to New York with my dad and with Nick. And we met with a really great doctor there. He's the head of, like, the chief of melanoma oncology at Memorial Sloan Kettering. He specializes in cutaneous, but he knew way more about ocular melanoma than the doctor who was treating me knew. The doctor who originally diagnosed me is like a breast specialist, like not even in the realm of melanoma. And so, anyway, that was the beginning of clinical trials for me. And in a nutshell, I spent all of my 30s in and out of clinical trials. I did the first one at Sloan Kettering. I was in that one for about 8 months. It was a pill I took orally. It was a MEK inhibitor. You are way more, you're way more better at understanding the science behind all of this. I am a marketing person and I'm a relationship person, so this is not my wheelhouse.
It's all good.
But it was an ass kicking. It was the side effects were a really bad rash and really bad GI. In the midst of that trial, Nick and I got married. We decided to build a house. My big thing in all of it was just keep putting something on the horizon, keep having something to look forward to. And I then did a couple clinical trials at UC Health here in Colorado. I had 2 liver embolizations where they injected 30 million radioactive beads to my liver. I had Gamma Knife in 2018 when it spread to my brain. And the liver embolization, I responded very, very well to that. I had tumors disappear. It stabilized my liver for like 4.5 years, which in the world of ocular melanoma is an eternity. I was surpassing my 16-month shelf life. And in May of 2020, scans showed growth in the tumors in my liver. And so it was kind of go time for another clinical trial. And of course, it was at the peak of the pandemic. TIL therapy is something that we had first heard about when I had my brain tumor in 2018. There's a doctor called Dr. Richard Carvajal based in New York, and he is incredible. He never treated me, but consulted with me on many occasions. Another big piece of advice I have for patients is build a team, figure out who the specialists are, make sure they know your name, make sure they understand your case. And when you're at a crossroads, you're checking in with every single one of them. And if you have a doctor who takes offense to second opinions and collaboration, that doctor does not have your best interest in mind. That doctor has an ego. There is no room for their egos in your fight for your life. And I feel very, very strongly about that. Dr. Carvajal is one of those doctors who just, like, I owe him my life. And he never treated me, but he always answered our calls. And when it spread to my brain, we knew then, even though it was stable in my liver, that we needed some sort of systemic treatment. And so that's when we started learning about TIL therapy. And Dr. Carvajal recommended Dr. Kamula at UPMC. And we didn't actually connect with him until we were seeing that growth again a couple of years later. And in May of 2020, it was go time. We had met with him 6 months prior, but my pet didn't wasn't active. It appeared that it was maybe dead tissue, and so he said we're not going to do anything. And then the pet was active 6 months later in May of 2020, and so that is how I landed in TIL therapy. And I just kind of talked at you for like 10 minutes, so I'll take a break and sip on
Yeah,
my coffee and see what questions you
that
have.
that's the 101 background to lead into this whole conversation is what was going on and how did you eventually find out about TIL therapy and and advanced cell therapy. What did you have to go through to get to that step first? And that's unfortunately the most common thing amongst the patient population is they only know what they are being told at where they are being seen at. And so that's 100% correct when you were talking about as a one, the doctor ego scenario, but the fact that your dad had brought up one clinical trials, we need to look outside of where we're currently at, and you're willing to travel. And Dr. Carvajal, I've met him on a number of occasions, and in fact the first time I had met him was in December of 2022, just a couple of months after I met you. And we were doing this mucosal melanoma hybrid workshop at Columbia, and was there for like 2 nights and got to go out, and I'll have to post a picture on here, but he's a lot of fun and he's a very heartfelt guy. And
Mhm.
I still keep in touch with him. And I just I always respect so much out of the oncology or just the clinical community that will admit, hey, this is something that is very aggressive. This is very rare, and you need to see the best. And if it's that they can admit that they're not the person, but you need to see whoever that person is, and that will
Mhm.
speak up. My oncologist at Texas Oncology, when I first got diagnosed in 2018, and I went to see her because she was just a local person, and she flat out told me, like on our first meeting, that your pathology is really rare. You should see a specialist. Would you mind seeking a second opinion? And I was like, yeah, of
That's
course,
amazing.
thank you. And
Do
so
you mind? Yeah, I don't mind.
I was like, yes, that's my best chance for survival. And the same kind of static Charlie Brown, like I got a phone call on like a Friday afternoon at 3:30, and I kind of described how I remember it, but I wasn't like in an office and everything. And so it's when you it first kind of hits you, it's like, is this real?
Yeah.
And I still to this day, I'm like, there was nobody with me at that moment to testify like on how I kind of took it, but I do remember being told to make the appointment for as soon as possible, and but not also to tell anybody until I had that appointment, because if I tell anybody, they're just gonna have the weekend to worry about it, and they're gonna have questions, you're not gonna have any answers, and once you go to the internet to go search and what's going on, it's gonna probably cause more problems than what it really is, and or not
Mhm.
what necessarily, but it's gonna make you worry. It's
Yeah.
the last thing you want to do. And so I did tell my family because I wanted to have somebody to go with me, but
Mhm.
I don't really recall going to the internet and looking it up. And I think by the time I did go to do that, that's just not like you find a lot of survivors or any positive information. And so
Same.
yeah, it's the people around you that kind of help guide and support on where to go and what to do. And I ended up learning about TIL therapy by default, even though I saw the word on my chart, and I think we might have asked about it, but it was if I was given the option up front to go, hey, there's a treatment out there that's, it's in clinical trials, it's been in clinical trials, and, for a lot of years, and a lot of different places have been working on it for different types of solid tumor cancers and so forth. But if you have an opportunity to do one treatment one time, even though, from resection to infusion, rather than do multiple treatments over a period of time, I would have just been like, yeah, like I would have raised my hand like, yes, um, absolutely. But I had everything backwards around, the clinical trials and the conception of it. I figured you had to do approved therapies first because, they're approved. There's a reason why they're
Interesting.
approved, and clinical trials as a backup. And knowing what I know now, I'd been like, FDA approved therapies and treatments, those are already approved. You can put those in your back pocket. But if you do a lot of those first, and then your cancer continues to grow and be more aggressive, and you physically and mentally just kind of you take the burden of going through, however long you have to go through what you need to, and then you learn about an advanced cell therapy, you might not qualify for it, and or you might not even want to do it or be strong enough, or you never
Yeah.
know. So but that's, they're not getting the marketing love that I see like on the evening news, when there's like a commercial and then there's something else that's being marketed, and I'm like, well, I took those, but those are a lot of adverse side effects, in fact, so
Well, and they're not like the problem with rare diseases is that these FDA approved treatments for other cancers are effective for other cancers, but they're not necessarily like there aren't solutions for the rare diseases like ours. There aren't off the shelf options. And so, yeah, you can take something that's FDA approved, but it's not likely something that's really helping. Um, and for me, I never Googled my disease. It's a decision that I made really early on. I'm glad I made that decision. I have learned in all of my networking with all of my new cancer friends that you are one or the other. Like some people, they want to Google everything, they want to know everything, they want all of the information. And some people don't. And neither one is right or wrong. It's right for you. And I had a very unfortunate encounter with another ocular melanoma patient who basically berated me in the middle of a small support group because I said that I hadn't Googled anything. And I think that she was projecting and I think she was hurting. But I actually left the event. I had flown to Atlanta from Denver for this event. And as soon as that happened, I was just like, I'm out. I don't need this.
yeah.
And I walked away, and I've learned I have to protect myself. And that's something I do to protect myself. And if you want to do research and that's going to help you, have at it. Um, and if you don't. And there's nothing wrong with either, and either one is okay. So I have very strong thoughts on that. And then something that you said a little bit ago about, if you could have bypassed it. Did you do treatments before TIL?
Oh, I did everything that exists is till
Okay.
I was on my way to hospice, and then was not a billable patient anymore on where I was at, and they actually ran till for a long time. But the day before they told me about it at my last appointment with them, they said that they literally had to shut down their trial because all of their employees got recruited to go work for the company that, or the sponsor for the trial that I did do.
Got
And they
it.
couldn't tell me about it, even though I qualified for it 9 months before I actually did it, because my oncologist's boss was a consultant for them. And so I, it's frustrating now. Sometimes I have to catch myself from being cynical or anything about because I went through and I looked through my notes and the recordings, and I understand everything so much better now. But at the time, I was just like, you tell me what to do and I'll do it. And they were telling me up front about how aggressive and everything it is, but there is some success and there is hope. But immunotherapy was supposed to be like the end game. But
Hmm.
I was scanning every 6 weeks, but every time I would scan, I would change treatment. So I did, monotherapy, combination immunotherapy, multiple different kinds. I have a couple of different chemotherapies, lymph node dissection surgery, a couple of different SRS targeted radiations. I ended up having to do fertility preservation. My thyroid went to hell immediately, and caught major colitis from all the
Mm, yep,
immunotherapies,
been
and
there.
and then I'm doing the roller coaster with the prednisone taper and in and out of the
Oh yeah.
hospital. And so yeah, I learned about TIL by default because I just there was only, like, basically there's two options. I say there was only one, but there's two, and but the other one was to do a chemotherapy pill called Ibrance and a single dose immunotherapy of Keytruda. And it didn't seem real promising. I think we ended up asking my oncologist, was this was your son or your family member, what would you do? And he said, I'd have him do TIL. So that was
That's
a
always
thing.
a trick question for your
Yeah,
doctor.
because
If this were you or your son, what would you do?
yeah,
That's the trick of getting their
that's
advice.
the yeah, exactly. You have to get them to make it personal and honest, and they have the medical oath of not being non specific about what they say and how they say it.
Mhm.
There's all those rules and everything. So, but I was traveling from Dallas to Houston just to see them, and then when I was like, okay, now it's time to do TIL, I was traveling from Dallas to Denver. And thank God, but right before I got my infusion, my baseline scan showed a brain tumor, and then it was like they weren't going to wait for me because they had a final infusion date. It was a late stage trial, so I'm on this like timeline to get back in. It was so devastating because I was like, wait, I did all this other stuff first. Basically everybody's saying you have this last option, and at the very last moment, now you're kicked out. And I was just like,
So in what year was this?
so this was in December of 2019, and then
Okay.
I they told me I did the went over the results on December 10th. I remember that specifically, and the very last day to scan to prove I had it stable and in reduction after doing radiation, because the rules say that you can't have an untreated brain metastasis and it needs to be stable or in reduction. And
Okay, so
so
did you
there's
do gamma knife?
yeah, it was 5 sessions to my occipital lobe, and I saw the radiologist, and they were like, we'll do 5, high dose sessions directly at it. It was 1 centimeter, and but we have to make this mold, and so that way we can pinpoint it exactly to the one specific spot, and hit it like we need to. But to even make the mold, they needed insurance approval. And so from
Oh,
December 10th,
so
and
many clocks.
the very last day to scan was Christmas Eve, so December 24th. It was actually the 25th, but they weren't open on the 25th. So it's 14 days,
And was
10
this back
business
in
days.
Texas?
Yeah, this is in Texas because I was
Okay.
like, well, where should we do this? And there's like there's no time to travel anywhere. Like we can do it here, and so uh, that same afternoon or the next day, we got a hold of the radiologist and went and visited them. And at the same time, like I'm clinically declining because the uveitis from all the prior immunotherapy was setting in, and my eyelashes were falling out, and I just had this goopiness going on, and I couldn't see, so I couldn't walk, and therefore, like, I wasn't moving around, and my knees were swelling up, and
Mm.
I was just looking really sickly, and I was getting wheelchaired around. And I was scaring everybody because I was just sleeping like 20 hours a day, and I remember my family was like, Chris, you got to eat, you got to move around, and all that. But it took 6 days out of these 10 business days to or 5 days or something. So yeah, to get the approval, and we got the approval. So the very next day we were able to make the mask, and then there was only actually 4 days to do radiation. So I was like, four is better than nothing. It's not 5, but
Mhm.
I'll take it. And on the fourth day, they let me go back in and do a double dose, and so they could give me all 5
Wow.
sessions. And then I went in the next day and scanned on Christmas Eve, and then I waited. Because there was still a washout period, from entering the hospital to getting the infusion. That's how everything backtracked. And it was all from this date of January 15th. So even though I scanned on Christmas Eve, um, we had reset to go back out to Colorado on like the 2nd of January of 2020 and met with UC Health on the 3rd and went over my results. And they told me that it went from 1 centimeter to 1.2, but they could tell it was inflammation, and my heart hit the floor at first because they didn't lead into like, yeah, you're good. They were
Yeah.
just like, did you get the results from me? I was like, no, I've been waiting for you to tell me like, what's up. And they told me that. And then I kind of got like the drill of questions about how I was feeling and doing because the
You're like, I'm
lymphodepletion.
fine. I feel great.
I was
I could
like,
handle
I was like, shit, I made it this far. Like, do not like tell me I can't get admitted. And they,
Yeah.
so like you can get admitted, but you still have to wait till the 8th. So it was like, okay, I got like 4 more days or whatever to get admitted. I already had a port. And so when I got admitted on the 8th, they gave me a PICC line and started doing the lymphodepletion. And it's 5 days of lymphodepletion, but they give you 7 days to do it in
Hmm.
case you need to take a break in between. And I
Is
did
that
all,
chemo or
yeah, it's two separate chemos, fludarabine and something with a C. I have it written
cytotoxin or
down.
something?
Something, yeah, something like that. I have like the whole chart of everything, every blood draw, I got 2 bags of blood, platelets, one during the lymphodepletion and then one in between the IL-2s.
Hmm.
But iron, whatever, all the different medications. I was on a palliative pack of pain meds for like a year plus leading up to this. Fentanyl, hydrocodone, Dilaudid, custom cannabis capsules, like all kinds of stuff. And I, but yeah, I did the week of lymphodepletion and made it to my day of infusion, which was January 15th of 2020. And then there was some extra people in the room, and they said that they were doing a press release because I was the last person to be dosed in this trial. And I remember thinking at the time, it's like, cool, like, I've never had a press release done about me. I've never been in the newspaper or had any article ever done. My family had made a Facebook page called Warriors for
Yeah.
Chris to give out updates, but I wasn't really posting about, hey, like, like for the year and a half leading up to that about my stage 4, like terminal cancer, because I didn't want the pity party kind of a thing. And
You're
so,
also just focused on survival. Like
yeah,
it's
that was
yeah.
100% it. I wanted to stay busy, and I was making a pretty decent salary as a home builder, and it kept me, moving and like, and, my mind, constantly consumed on something else. Cause there's a lot of scheduling, taking a house from scratch and, organizing all the parts and materials and inspections and buyer walks. And, you built a house, right? Or bought a house. And it's it was a lot, it was a lot to keep me busy, and I still had to maintain insurance. I knew that that was important.
Mhm.
And thank God I had signed up for short-term, long-term disability, and like the whole package is someone when you're single and you're like, yeah, I'll take, whatever benefits you got. Like, you
Yeah.
know, you don't know. And so that was one of the things that I'm like so glad that I had a solid PPO. I had all of that. And but yeah, like I got my infusion on the 15th of January and kind of forgot about that press release thing because it was just like whatever. And then
Because
they
you're
come in
totally
and yeah, I was like, I was a fall hazard when I came in, and I was just it's living in a hospital for I was in there like 12 days. It's not like comfortable, you can't
no.
uh really get used to it. You don't know if it's day or night. The sleep factor, you just kind of rest when you can.
Oh yeah,
But
because you're not getting good rest. You're
yeah, it's
sleeping,
not.
being
Yeah,
interrupted
the
every
it's
hour.
and my dumbass got my pick line on the opposite side of my body than what my port was, and so I had like all these lines crisscrossing. So
Oh,
if I moved over to try to lay on my side, I was tugging on one or the other, and it all just sucked. And but on the day of my infusion, it was like they bring in this, pink ectoplasm Ghostbusters looking bag of this like saline thing. I didn't feel nothing or anything. And then it was the next day they started the IL-2s, and I ended up doing all 6 of those. I think the first 3 were spaced out like 8 hours apart, and then the second 3 12 hours apart, or vice versa. And they tell you about the Rigers, but I've been told about side effects before that may or may not happen and how intense they may or may not be. So I really, I was like, okay, whatever. Like, but that was the most intense thing out of everything I had done up to
mhm.
that point. But made it through all 6 of those. And then I was let out on like the 20th of January. And then I stayed in town for another like week or 10 days after that. In the first 3 days, I just went back in for like 2 or 3 hours for some minor infusions or whatever it was, and then had to travel to like 2 weeks later to go back and just get a checkup, and then 2 weeks after that for my first follow-up scans. And at that follow-up, they said I was 50 to 60% in reduction of like everything, and then COVID hit in March.
Mhm.
And then so they were allowing me to do telehealth, which was great. I would scan in Texas and send the disc and do all of that. But when you mentioned May of 2020, I'm sitting here thinking that's right when it came back, and you were like, okay, I gotta, you're getting into TILs.
It's good
That's the
timing.
month I went back to work.
Yeah.
And it was sucked so bad because all I wanted to do was be around people, and I
Yeah.
was told I had to be alone. And my whole infrastructure of support that was all surrounding me, like it was, it just went from being around everybody to being around nobody. And I had built a house while I was sick. I'd put all my stuff in storage, and I was working, so I was able to save some money. And so it closed on it before I went in for my till. And so when I got out, it's like I'm coming back to this empty house, and it was it was insane. And I didn't start talking or sharing anything about my cancer story until like 2021 or 2022. I think I rejoined a Facebook group that I
Hmm.
was a part of that I disconnected from because it was too tough. And then I saw a SITC abstract at the like middle or the end of 2022, and my NCT number for my trial looked so familiar, and I went to look it up, and I was like, oh shit, that's my data. And then I went and found that press release from January 2020. I'm like, I just went like full throttle into I gotta know everything about this, like, because it just didn't, none of it seemed real, like
Yeah.
it just. And I was like, well, it was. And it did. And
Yeah.
that was my therapy, to talk about it, because I didn't talk about it while I was going through it. And I'm just sitting here thinking like, oh my God, like if I would have just known, with one treatment one time, and it's my whatever made me sick is going to make me better. And it finally made sense. And I'm like, it blows me away. It just blows me away that I did not know anything about it sooner. I didn't ask about it. And
Well, I think someone asked me that last week. If you could have bypassed everything and just done till, would you have? And I was like, of course. Like, duh. And I think there are a lot of misconceptions about till. I've spoken, I mean, you and I both probably speak and advise so many patients, and you started the till group on Facebook, which I think is phenomenal because it gives people a chance to come in and ask those questions. But the number of people who, when I suggest explore till first, who say, it feels like a last ditch effort, I'm like, it kills me to hear that, because also you are very lucky that you went in not very strong. Like, it sounds like you were being
I have to
told to
send you
shed a
some
very short.
pictures.
You were not strong, and it is not an easy treatment. I've heard of people who've not made it through the treatment, and that's not common. But I think that at least what I told myself was that has to be people who are really, really not very strong. When I went in and did till, I hadn't had any systemic treatment um, since 2016, maybe.
So it had been like six
So
or 5
it
years, right?
it had
4 years.
been it had been quite a while, and I'm young. I work out a lot, and that's my motivation to working out, is keep my body strong because we never know
You
what's
never
coming
know.
next. And that's why I stay active. That's why I push myself on the Peloton and do my classes and lift weights. It's not because I'm trying to get super buff. I am just trying to keep my body strong. And I felt like, okay, I know this isn't going to be an easy treatment, but my body is as ready as it's going to be. I honestly, in comparison to the other treatments I had had, I would say the hardest treatment that I had in comparison in just the clinical trials was the trial that I did at Sloan Kettering. And I tell people that I didn't know, with that one, there was no end in sight. It was indefinite. You enroll in that trial, and as long as you're stable or you show improvements, you're in it. And I'm taking this pill every day, and I am dealing with colitis. I am dealing with a rash. I am dealing with, I looked, by the time I entered the second arm of the trial and I was taking 2 pills orally every day, I lost 30 pounds. So I was flirting with the double digits. My skin was gray. I couldn't even stand up straight. And I worked full time through all of this, and everybody at work was just terrified because I just looked
Yep.
so sick. Of course, I didn't lose my hair. I eventually did twice. But when I was at the beginning of my treatment, none of my treatments caused me to lose my hair. And so everybody around me was like, well, you must be fine. You have your hair. I was not. That treatment was so hard, and I didn't know how long I'd be in it. With TIL, one of the advantages is, yes, it's a challenging treatment, but you know the timeline. You get
Yep.
your harvest, and then when you go into that hospital, you're in there, 2 to 4 weeks. I was in the hospital, I think, for 17 days. I had a calendar. I brought a dry erase marker and a ruler. I don't know how I thought to do that, but I drew a calendar on the window, and the doctors and nurses loved it. They're like, this is so great. And I was like, well, yeah, I'm type A. I need to know, like, this day is over
Yeah.
and what's
How
coming
many
next.
more? When can I get out?
Yes. And so, but as soon as I was done with IL-2, and that was the hard part. I mean, the chemo, yeah, it wasn't very fun, but like, it was the middle of the pandemic, so it's not like I was missing out on anything. My
Yeah.
high school reunion took place because by the time I had TIL, it was September of 2020, and so my 20-year high school reunion was happening, and half of, like, I graduated with 50 girls, and I think maybe like 10 people showed up in person, and then 10 of us zoomed in. And I'm in the hospital, and I'm like, I've got like my rash, so I have like ice packs all over me, and like, I just look ridiculous, but I joined in for that. And then the IL-2 was obviously the hardest part. The TIL infusion itself was uneventful. But once I was done, I was done. And my body was exhausted, and everything that could have happened to me happened, every side effect. I only had Rigers once. They gave me something for that. I never got them again. I got all 6 of my IL-2. I had fluid in my lungs. I had my period, and it was, because I had, my platelets were low, it was like a 10-day super, super heavy period, which the whole world knew about. I had to have a blood infusion for that. Um, I, I mean, it was just everything. It was not easy. But then I went home, and we just hid out, and I got strong. As soon as I could start cycling again, as soon as I could start getting strong again, I did. And I would say it took about 6 months for my body to finally just taper out and get back to regular cadence. I was perimenopausal post treatment. I was having horrible mood swings. Like, my husband would
Yeah.
find me like curled up in the fetal position, like projectile crying on the floor. It was a lot. I had this like weird rash that was just like moving about my body. Like, I thought I had a blood clot um, in my calf, because it was like in my calf at one point and be on my head at one point. It was nuts. But got through it, and my
So,
body finally got stronger again. So yeah.
all right, in consideration of time, this will conclude the first part of the conversation with my guest. But no worries, we are picking up right where we left off with continuing talking TILs on TIL Talks and all advanced cell and gene therapies in part 2. So stay tuned, it's coming up next.